So diabetes is a big problem in our community, in our society, but what is it about diabetes that creates a problem for the feet? So we're just going to talk a little bit more about that now. The two main areas as podiatrists that we find diabetes has an effect on in your body in relation to your feet are the nerves and the flow of blood to your feet as well. So if we look at the nerves in your feet, nerves detect sensation, they activate movements, they control body functions. So all of these things are vital to have your feet moving and functioning properly, as well as your whole body. The interesting thing just to remember is there are no pain nerves. There are no nerves that detect pain. I find this fascinating. Pain science is really, really quite incredible. So the way that pain works is that the body responds to sensations. So for example, you put your hand onto a hot plate. The body registers that heat and then it sends all that information to the brain where that information gets processed to determine whether that source or that sensation you're getting is a risk to you. Now pain, think of it as a risk score. So if you've got a little bit of pain, that's the brain saying, oh, that's a little bit of risk down there to your body. It might cause some damage. Be aware of that. When you get a lot of pain, that's your brain saying, oh, I don't like that. Something bad's going on down there. You better pay attention to it and deal with it. So pain levels can go up with the degree of sensation you're getting at that source. It can go up because of the way you're feeling, your emotional state, history, all sorts of things. But there are no specific nerves in your body that detect pain. But all of these nerves are detecting a whole bunch of other things as well. So when we start to lose that nerve function, that's why pain is reduced, because the brain isn't getting the information it needs to tell whether that stimulus is a risk for you or not.
So Anthony, if there are no pain nerves,
yep.
how is the sensation moved into your brain?
It's still through the nerves, definitely. So there are we'll go on to talk about that in a moment. Talk about that a bit more. So there are nerves that detect heat. There are nerves that detect fine touch. There are nerves that detect movement. There are nerves that detect damage to the skin, so cuts, scratches, and all of that information about movement, heat, fine touch, all of those things are what the brain processes to determine whether that's a pain sensation. Does that make sense?
It does.
It does, yep. So nerve damage or a condition called neuropathy can develop when you've got increased blood sugar levels in the body. So increased sugar in the bloodstream can cause a lot of damage, and with nerves it damages the insulating sheath around the nerve that allows the electrical impulse to pass through to the brain. It can damage the nerve itself, and it can damage a whole lot of other structures. But if the nerves are damaged, they don't work properly. Think of an electrical cable. If you've got a happy, healthy electrical cable, the electricity runs through that cable quite nice. If there's damage to the conducting sheath around the outside of that cable, then the electricity might spark off somewhere else and you might not get the flow through there. And the same thing happens to nerves. If you have a sensation down here that sparks an impulse through your nerve, but that nerve is damaged, that impulse may not get to your brain, so the brain can't process what's happening at the extremity. Does that make sense? Yep. And this is what we see happening with diabetes. Because of those elevated sugar levels, those nerves get damaged, so they don't function as well as they should. And then that can lead to this condition called neuropathy. So nerve changes decrease the feeling in your feet. So for example, I've seen clients in the clinic with diabetes and nerve damage who have trodden on a pin and haven't felt that happen because that nerve sensation doesn't work. And they've walked into my clinic and go, oh, what's that? I go, what's what? And I go, there's something in your foot, and you've pulled out a pin, and they go, oh, I didn't know it was there. And that seems, I mean, you sort of think, well, how can that be? Surely you can feel that. But this is what diabetes can do. It can change the level of perception through these nerves so that you don't actually have that feeling or sensation underneath your feet. So you can get a loss of pain sensation in your feet because if those sensory inputs from the feet aren't getting to the brain can't process whether that is a risk for you or not, so your pain levels are reduced. Pain is an important part of our protective mechanism. If we get damage, we need to know that damage is there so we can treat it the tissues get healthier, and we're not at risk of infection or further problems down the track. But if we lose that ability to process that sensation and determine that pain, we don't know what's happening, and then we can develop other problems because of that as well. And that just basically leads to an increased risk of unnoticed damage, which is a big problem when it comes to diabetes. You think about going for a long walk, getting a blister on your foot, you go, oh gee, that hurts, and you have a look, you do something about it. If you don't feel that sensation of pain and you've got a blister on your foot, you won't treat that. Then you can get an infection, then that infection can spread, then that can become more of a problem for you. So allowing your body to know when something's wrong at your feet is vital for keeping us healthy. Some people, however, with diabetes, it's not about losing sensation. When the nerves are damaged, sometimes you're still getting those sensory inputs to the brain, but the brain is getting a different message, so it doesn't know what to tell you basically. If you're not getting enough sensory information to the brain, you lose the feeling of pain. But if that message is changed, the brain might go, oh, that's weird, I better make you more aware of that. So some people with diabetes actually get an increase in pain levels because their nerves are damaged or their nerves are changed. So then some people can actually get a hot, tingly, painful foot because of the nerve damage, and that's what we call a painful neuropathy. So you can get a neuropathy where you get a loss of sensation, or you can get a neuropathy where you actually get altered sensation and the foot doesn't feel right. And I've had clients explain this like, it just feels like I've got this burning, prickling feeling in my feet all the time. Some people describe it like they've got ants crawling on their skin all the time as well. But it's just because the nerves are damaged and they're sending a different message to the brain now rather than what the brain should be receiving. Does that make sense? Yep. You can get skin changes. The nerves control the health of a lot of our tissue structures like the skin, the bones, the muscles. And if the nerves that control perhaps the moisture producing glands in your feet don't work properly, you're not going to have those nerves telling those glands to produce moisture anymore. So suddenly the skin becomes a lot drier. So we often see people with diabetes with very dry, brittle skin, which can then lead to cracks and infections and problems like that as well. And you can also get joint changes. The nerves control the muscles. If the nerves aren't telling the muscles to work, then the muscles aren't supporting the bone structures, and we can actually get collapsing of foot structures or changes to the way the feet work. Some people will develop clawing of the toes, which then get rubbed from shoes, and that can cause problems as well. If we want to go and get really complex, there are different nerves are constructed slightly differently. There are some nerves with that sort of insulation cable around the sides of them. There are nerves without that as well. And they all detect different things. But high sugar levels, basically, the most important thing to remember is it damages nerves. So it reduces the function. Mm-hmm.
If you stub your toe,
yep,
you get a lot of pain.
Mm-hmm.
Where's the nerves? How come the nerves
well, there are
telling you that there's pain?
Yeah, because there are nerves in your body that detect pressure. There are nerves that detect skin damage. There are nerves that detect bending. So all of those nerves detect that sensation of your foot or your toe hitting the solid chair. Then they send that impulse to the brain, and then the brain says, oh, that's quite a bit of damage. I'm going to create pain down there so that you're aware that you've done some damage there. So without that impulse getting to the brain because of the damage with diabetes, you'll know you've kicked it, but you won't know the degree of damage that you've been left with at the end of the day. And that's the big problem. If you don't understand or you don't know the degree of damage, you'll just go, oh yeah, that was okay, and you get on with life. But you may have ripped the nail off of your toe in that situation, but have no sensation of that, and so you don't do anything about it. And that's where we get into trouble with diabetes. Yeah. So the other major change that we see with diabetes is changes to the flow of blood in the feet. Now, blood flow keeps bones, muscles and skin healthy. It moves oxygen about the body. It helps to fight infection by moving all the good cells that fight infection into the feet. And it helps to repair damaged tissues, getting nice, healthy, oxygenated blood down there. So once we start to get damage because of the blood flow not working properly, we start to have problems with feet there as well. So damage to the blood flow of the feet, this is called peripheral vascular disease. Peripheral meaning far away and vascular being blood flow. It can occur with increased blood sugar levels. Poor blood flow to the feet can cause many, many foot problems. And if you've got nerve damage as well as poor blood supply, that really increases your risk of problems as well. Because if you don't know something's damaged on your foot and the flow of blood is not getting down there to heal that up quickly, things take a lot longer to heal and you can be more at risk of infection, and these problems compound all the time. So with blood flow changes, we get delayed healing. So I've noticed as I've got older, things don't heal quite as well as they used to. When you're a really young person, you know, you get a cut or a scratch and it feels like the next day it's all healed up. So as we age, our healing can be a little bit slower. But if we've got poor blood supply, that healing takes much, much longer than what it would normally do. So reduced blood supply slows down the normal healing process that we all go through. We talked earlier about blood flow helping to reduce risk of infection by bringing on all those lovely cells that fight infection. So if you've got reduced blood flow, infections can build up and develop much more quickly than what they would normally do. And if the flow of blood's not great, infections tend to get bigger and they spread, they get into other parts of your foot or your lower leg as well, and that's where we have a lot of problems developing with diabetes. We need that good blood supply to heal up any tissue as quickly as we can and to fight any infection or bacteria that might be down there. There's an increased risk of ulceration. Now, we'll talk a little bit about these sorts of foot problems in just a minute. Foot ulcers are a big problem with diabetes, and they can be caused by a lack of feeling in your feet or poor blood supply. Now, a foot ulcer basically is a wound that hasn't healed properly. So for example, if you fall over and you take a bit of skin off your leg, normally that heals in maybe 3 to 4 weeks quite happily. If that wound doesn't heal, that's what we refer to an ulcer basically. Now, feet are very much at risk of developing ulcers because if the flow of blood's not getting to the foot, then that wound doesn't heal, which then causes more tissue breakdown potentially, and it can cause an ulceration. So the longer the ulcer or the wound is there, the more chance of infection has of developing, which then puts us more at risk of foot problems. So there's a risk of gangrene. Gangrene is basically where the skin dies back because it's not getting enough blood supply. Fortunately, this isn't something that happens a lot these days. We've got great surgeries to improve blood supply, medications, all these sorts of things, but I have still seen people with gangrene develop because their diabetes has damaged their blood supply so badly. So the whole point about what we're trying to do today is to just sort of educate people to say, hey, if we look after our feet and do the right thing, we can minimize these risk factors, and that's really what we want to do as much as we possibly can. And cold feet. Anyone here get cold feet? I get cold feet and fingers all the time. Cold feet is just a sign that the flow of blood to your feet is not as good as what it should be. It's the warm blood flow moving through our skin that keeps our body nice and warm. So if you're feeling cold in the fingers or the hands, it's often because that flow of blood's not as good. The body's very clever. What it wants to do is it wants to maintain your core temperature as close to that 37 degrees as it possibly can. So if it detects that you're getting, if it detects that the environment is cold, it doesn't want blood flowing to the tips of your fingers and toes where it can chill, because that chilled blood would then come back and lower your core temperature. So what it tends to do is it just slowly reduces the blood flow to your extremities to maintain your core temperature. But the problem with that is that the less blood flow you get to your fingers and your toes, the colder they become. So the body goes, oh, it's still cold, I better shut that blood flow down a bit more, which makes them colder, which means less blood flow, which makes them colder and less blood flow. So this cycle can build up. That's why sometimes it's easier to keep your feet nice and warm rather than to let them get freezing and then try to warm them up again. And as podiatrists, we talk a lot about trying to maintain a good temperature around your feet rather than getting them through the cycle of hot and cold and hot and cold and hot and cold. So circulation changes makes your feet a lot colder just because you're not getting that warmth circulating around as much. Skin changes as well. Blood flow is important to keep all the glands and the structures in your skin healthy. So we tend to find that people with skin change or circulation changes can have much drier skin, and it becomes quite brittle and fragile as well. So keeping the blood flowing helps to keep the skin as healthy as we possibly can. And some people can get cramps. If you're walking and you're developing cramps in the back of your calf muscles, that can be a sign of poor blood supply to your feet as well. And it's not so much if you're laying in bed and you get cramps or anything like that. It's when you sort of walk maybe 10, 15 metres and suddenly the calves really cramp up. That can be a sign that there's a reduction of blood supply to those muscles. Muscles need oxygen to stay healthy and to keep functioning. If your muscles are cramping up with just a little bit of activity, that's a sign that maybe we should get that blood flow to those areas checked out. So I've taken some numbers from Diabetes Australia just to look at how Australian feet with diabetes affected. So more than 27,000 people are being admitted for diabetic foot ulcers each year. That's a lot of people. That's a big number. And that means these people have had significant damage to their feet because of their diabetes to develop a foot ulcer, which may then get infected, so much so that they need a hospital admission to manage that. 27,000 people. There are more than 4,400 amputations every year because of diabetes. Now that number is bigger than any other reason of amputations, basically. Now, amputation is a treatment of last resort. We have lovely, great antibiotics, great surgeries and things that can help people with problems in their feet. But if someone has developed an infection that is spreading into their leg that threatens their life, amputation is sometimes the only treatment available to that person. So once again, this is why we focus on minimising risk of diabetes.
Yes, I'm aware of that as a reality because a close friend of mine has lost both feet
Yeah,
as a result,
yeah,
and he has class 1 diabetes.
yeah. It's a terrible thing.
Yeah.
Yeah, and you think about that from, well, I think about that from the change that person's life now, and you know, everything changes. If you've had something major like this happen, you need so much more help at home. You know, for someone who's older that this happens to, that could mean a nursing home admission. That can be a complete change of life. But if we do the initial steps to try and minimise the risks of diabetes, you know, changing our lifestyle and things, that can help us prevent these sorts of things from developing.
One thing it didn't do was change his mindset.
Yeah.
He's still as funny as ever.
Yeah, that's good. Yeah. And you know, these sorts of things don't have to change us, but they have a great capacity to make a big difference in our life. More than 1,700 people with diabetes die because of foot ulcers and lower limb wounds every year. That is too many, way too many. You know, these are, most of the time, these are preventable complications. So if we can do the right thing and look after ourselves and get the right help, these things don't have to happen. You know, I don't mean to put these numbers up to scare people. This is, for me, this is always a good reality check. This is what the real risk of diabetes in your feet really is. And 8% of all diabetes-related deaths are a direct result of foot ulcers and lower limb wounds. So once again, that was just a 2005 number. So that was 15, 17 years ago. So that number is probably very different these days as well. And diabetes foot-related disease costs around 1.6 million every single year. So this is how much the healthcare system is spending just on foot-related diabetes problems. They're all really big numbers, you know, they're not small numbers, they're not insignificant numbers. And I guess as a podiatrist, I still see these numbers and I still get shocked that, you know, these things are still a massive burden on us, our families, the people we care about. So as a podiatrist, I'm always thinking, what can we do to change it? So this here, what we're doing today, this education, this is about how we can learn to do things differently as well. And if you can go out and share that information with other people, that makes a big difference, I think.